for a lot of women, perimenopause and especially menopause can be a second spring. Okay, it can be something to look forward to. There are a lot of good things that happen. It's not all doom and gloom, and I don't want people to fear it. I want people to educate themselves about it, which is why, whether you're very young or in the average age group, I still want people to educate themselves so that you know what to expect and that there is help out there if you want it.
You are here for a reason, but navigating this human life can be challenging. How do you care for your body, mind, and spirit to make the most of your time here on Earth? How can you harness your incredible human potential? In this podcast, we explore these questions and more to help you craft your best life yet. Welcome to I Am Human. Hello, humans. Welcome to another episode of I Am Human. I am your host, Dr. Yami, and I'm so happy to be here with you today to bring you a super important episode on a topic that is going to affect at least half of us in this world. So I'm so glad that you're here with me today. And if you haven't already, if you could please subscribe or follow my podcast on your favorite podcast player and also rate and review it. And if you think that this would benefit another person in your life, please share it. They will get to know my podcast and they'll also get information that could potentially change their lives. So thank you so much for being here every week. And if you're new, welcome. So to be human means that we're constantly changing. We're constantly evolving. Our bodies are constantly changing, and so are our hormones. And especially if you have a female reproductive system, that can at times feel tumultuous. It can feel like you may be confused about the changes going on in your body, but it's part of the human experience. And today I am bringing you an expert that's going to help us better understand that perimenopause, menopause transition, because it's something that has affected me in my life. And I think I was caught a little bit off guard. And so I'd love to educate you and empower you so that you know what to expect, and also that you can realize that there's things you can do to help ease this transition and to feel empowered in your life. So I have with me back again the amazing Dr. Nitu Bajekal. So Dr. Nitu Bajekal, MD, is a senior consultant obstetrician and gynecologist in the UK with over 35 years of clinical experience in women's health. Her special interests include lifestyle medicine, PCOS, endometriosis, period problems, menopause, precancer, complex vulval problems, and medical education. She is a keyhole surgeon with experience in laparoscopic procedures, including robotics. She is a fellow of the Royal College and a recipient of the Indian President's Gold Medal. She is one of the first board-certified lifestyle medicine physicians in the UK. She has written the Women's Health module for the first UK university-based plant-based nutrition course. Dr. Bajekal is passionate about spreading health awareness, providing reliable medical and lifestyle information for the general public, doctors, workplaces, and schools. She herself follows a vegan lifestyle, and her family and she herself have benefit from this. Dr. Bajekal is the co-author of Living PCOS Free, along with her daughter and nutritionist, Rohini Bajekal, released worldwide in April of 2022. And her latest book, Finding Me in Menopause, will be released this year, 2024. So in this episode, we talk about Dr. Bajekal's experiences with menopause, definitions, what is menopause, what is perimenopause, the age ranges that women typically experience this transition, typical symptoms, but also some kind of weird atypical symptoms. We talk about what percentage of women experience bothersome symptoms and what percentage of women actually seek help. We also talk about what different groups may experience more severe or prolonged symptoms, and who we should go to when we're ready to seek help. But most importantly, Dr. Bajekal lines out the 6 lifestyle pillars and how they can help us in this transition, how they can help ease the symptoms, but also increase our well being and our longevity. And then we briefly talk about hormone replacement therapy, who would be a candidate for that, and another thing that's very important is her thoughts on what this transition means and how we should approach it. So I think that this is such an important and impactful episode, one that you could probably keep coming back to over and over again. And if you yourself haven't gone through this transition, but you know somebody that you love is, this is just good to listen to help support them and help understand what they're going through, because it can feel like you're losing your mind a bit. And like Dr. Bajekal said, sometimes you have symptoms and then they go away and you're like, did I imagine having that? So it can be a little bit confusing, but hopefully this will enlighten you and, like I said, educate you and empower you as you prepare or as you're going through the transition. So thank you so much for being with me today. I appreciate you so much. And now let's welcome Dr. Nitu Bajekal. The information on this podcast is for informational and educational purposes only. It is not meant to replace careful evaluation and treatment. If you have concerns about your health or well-being, please consult a healthcare professional. Dr. Nitu Bajekal, welcome back to the show. It's so nice to see you, my friend. Thank you so much for coming back on.
Thank you. Thank you so much for having me. It's been a few years and it's exciting because your podcast has grown in so many different ways, hasn't it?
Oh, yes, it has. But also, this is a perfect topic because I'm super into perimenopause. I feel like it's funny because it's like people, I've seen that term heavily pregnant. I was like, what's heavily pregnant versus just lightly pregnant? But I'm definitely into the middle of perimenopause now. So I am so glad that you've written this book, Finding Me in Menopause. And I know that we've been corresponding a little bit because ironically, I didn't know you were writing this book. And I reached out to you and I'm like, I need to teach a class on this topic because my students are asking me, they want to know more about this topic, how they can use diet and lifestyle to support them. And when I reached out to you, you were like, actually, I'm writing this book. And I'm like, oh my gosh, that's perfect. So definitely want to talk more about this topic. And you've been on the podcast before and you've given your story, but maybe you can give like a little summary about your experience because you hit that milestone pretty early on. It wasn't something that you were expecting at all. So maybe talk a little bit about your story and then we'll get into definitions.
Yeah. So I didn't really have perimenopause, I think, because I was 38 when my period started wrapping up. Well, that was perimenopause, and um, but I didn't expect it to be so early because my mother and my sister hadn't really experienced menopause that early. I was very busy and I put it down like women do. They always find reasons other than the real reason to take care of themselves. And I thought I was just working extra hard. I was a very busy doctor. I was applying for consultant jobs. And I was also being bullied, actually. So a lot of combination of things. And when my periods finally stopped, it hit me that what I've been going through was, menopause and perimenopause. And it was well before the expected age of menopause, which is anywhere between 45 and 55. But most people tend to stop their periods around 50, 51. The global age is about 51.4, and I was 38. So it's a different condition, a medical condition called premature ovarian insufficiency. And despite having had been in OBGYN at that stage over 16, 17 years, although if somebody had come to me and asked me what the diagnosis was, I would have been able to give it. But for my own self, I, in a way, it's good. You don't want to be your own patient, right? Or your own doctor. But when I did face up to the fact that I had stopped my periods, it was quite difficult because I was really having quite a few symptoms, and I should have received hormone replacement therapy. I wasn't bold enough to talk to my colleagues. I'd just become a consultant, and I was very aware. I was an immigrant, I was a woman of color. I wanted to reach the top. I didn't want any pity parties. And so I saw my family doctor, who basically refused to give me hormone replacement therapy because at that time, to no fault of his, it was basically to do with the fact that there was a WHI study and misinterpretation of the study, which suggested that women who took HRT would actually end up worse, which was not really true, has never been true, and now has been put to bed. So that was my experience. But about a year into experiencing those symptoms, and I discuss my story in my book in some detail. I um, changed my diet because my younger daughter decided to change her diet and go vegan. And so when I adopted, because I knew there was no discussion, I was going to do anything to support my daughter and make sure that she had a good diet, and I was particular about that. I changed the way I ate as well, and I had an improvement in a lot of symptoms. But I still didn't put two and two together because I had never been taught nutrition. I did not know that there was any link with what you ate. Well, vaguely, but nothing really, And so it took me another several years to actually join all the dots together.
Yeah, wow, what a journey. And it is difficult because during this time that we're going through perimenopause, menopause symptoms, a lot of women are in the height of their career. Like they're finally to that point that like they feel like, okay, I'm gonna get this, I'm getting this, I get life, I'm figuring this out. And then bam, something like this hits you and it kind of disorients you, especially when nobody talks about it, right? And I think that's what I really want to get out is to get the information out so that women know kind of what to expect when they start having those symptoms instead of putting it off to something else. Or like, oh, okay, this is what they were talking about. This may be a sign of perimenopause. So let's get into the definitions. What is perimenopause first? And then you can talk about what the definition of menopause is.
Yeah, and just coming back to that point, it's really never too early or never too late to learn about menopause and perimenopause, because it can affect people at different ages, like it did in my situation. And so you want to be empowered well before, and that is important. So perimenopause is the time or the transition to menopause, which basically means in the years surrounding the time. So we start actually with defining menopause. Menopause is once somebody's periods have stopped for an entire 12 months. So no periods for 12 months. So it's a retrospective diagnosis, which means that you haven't had periods for 12 months and you look back and say, now I'm menopausal or postmenopausal, and you remain in that phase for the rest of your life. The average life expectancy is in the West is women into their 80s, 83, 88 in Hong Kong and Singapore and things. So you're spending over 3 decades in that phase. So people often say, oh, but I've already been through it. No, you're never finished with menopause. You're always menopausal or postmenopausal. And that's a good thing in many ways, because there are many good things to be celebrated as well. So perimenopause is the time before. And so perimenopause can be anywhere between 2 to 8 years, taking different women will have different experiences. Some women will have no symptoms, but generally speaking, it can last anywhere between 2 to 8 to 10 years before you actually stop your periods. The average duration of perimenopause is about 4 years. So around the age of 47, if most women stop their periods around 51.4, as we say. But imagine the range is 45 to 55 for menopause, Yami. So you can imagine that if it's 8 years before, it could be as early, perimenopausal symptoms may start as early as 37, when some women haven't even started thinking about starting a family. So it is so important to know about these things, because a lot of people are not even aware that they know there's a biological clock, but they don't really realize how steep the decline is after 35, after 37, and also how the hormones can fluctuate. And it may be that you're experiencing those well before, because perimenopause is the time before menopause. And yes, you may be in that. Most women are around the age of 47 when they start experiencing perimenopause, but it affects different people and different races differently as well. So we can't just assume that we're going to hit 47, then have 4 years of perimenopause. That means the transitioning into menopause, and then stop our periods. It doesn't always work. And perimenopausal symptoms can be very similar to menopausal symptoms, but with added things. You can have heavy periods, you can have periods that start crowding together. Most women in perimenopause will start hopping and skipping periods, so that you'll have a period in January, then nothing in Feb and March, then you'll have a whole row of periods, between April and August, for example, and then nothing again. And slowly the periods start fading away as the number of eggs drop in the ovary. But for about 10% of women, they will notice that their periods are getting very crowded together, they're getting very heavy, they may get painful because of conditions that have got worse over time, called adenomyosis. So, and you can have the usual symptoms that most people associate with menopause as well. And then all the symptoms disappear, and you think, oh my gosh, did I just imagine all that? Was that happening to me? Was I really having low mood and low libido and, hot flushes? And now I feel absolutely fine because your periods have regulated themselves for a little while. So it can be a difficult time, but there are plenty of women who won't actually have many symptoms at all.
Yeah. And one of the things that you wrote in your book, and I discovered on my own too, is that women of color may have prolonged duration of perimenopause and
Correct.
sometimes even more severe symptoms of
Correct.
perimenopause.
We know that women from the Indian subcontinent can usually become menopausal by the age of 47. So that's 4 years earlier. So their perimenopausal symptoms may start even earlier. So if you can imagine, it could be, in your late 30s, very early 40s. Black women may find that they have much more intense menopausal symptoms and may start menopause, earlier as well. So it could be all these things. If you're not aware as a person, as a human, and also as a health professional, you can do women a big disservice, because you might dismiss them when they've actually got symptoms that need to be, taken care of, or at least listened to.
Yeah, I think this is so important, especially how you mentioned earlier about fertility, because, like I said, we're having babies later and later. Women are focusing on their careers. They want to travel, they want to do things. They get to their mid 30s, they're like, okay, I'm ready to settle down and have a family. They may not be aware that they've already started on perimenopause and those hormones are starting to decrease and fluctuate. I definitely wasn't expecting that. I was done having a family, thank goodness. I wasn't even thinking about that. But my very first symptom of perimenopause was actually brain fog. I started forgetting, not forgetting, but I was having a hard time with vocabulary recall. And in my profession as a physician and podcaster and speaker, I just lost that feeling of being sharp. And it
Correct.
was really concerning to me. I had so many conversations with my husband. I was like, I know this is early Alzheimer's. I know I have Alzheimer's. It's early Alzheimer's, And so I didn't understand, why is this happening? Why am I starting to get brain fog?
Yeah.
And then a couple years, 3 years later, that's when I started having issues with my periods.
Correct.
After, like I thought plant-based diet was a miracle because I had no pain. My periods were so easy, light, and then suddenly got heavy, painful. I feel like I started developing PTSD with how much pain I was having, and it just didn't make any sense. And, that's when I started putting two and two together, and of course, help. And I spoke to you too that,
Yeah.
yeah, probably I'm having perimenopause, and that's why this is all happening. And I definitely was not expecting it that early.
Yeah, and conditions like adenomyosis and all often tend to raise their heads. This is it's a chronic inflammatory condition that can make periods newly more painful, and so women should be aware of that. It's not natural to suddenly start having pain if you've not had pain before, or if you've had pain before. Of course, it has to be looked into, but. You're so right. It's so easy not to be aware of these symptoms, and as a result, start attributing them to, like I did, to stress and things like that, which may be true, but you do need to have a proper workup so that you can actually come to a diagnosis. And if it is, then it is perimenopause. That's a different matter. You may choose to do just diet and lifestyle, or you might choose to use hormones, but it's important to know, or you may choose to do nothing. But it is important to be aware, because without knowledge, it's very hard to come to any decision for oneself.
Yes. Okay, so you mentioned this earlier, which I think is probably the most well-known symptom, which is hot flashes. I think everybody's heard of or, expected maybe I might get hot flashes, but there's some also really strange, weird symptoms that nobody ever talks about. So can you mention some of those weird symptoms that people can have when they're going through this transition?
So I don't come across them often, but women may mention ringing in their ears. So in a tinnitus, they may notice a feeling of sensation, what is known as formication, a feeling of as if ants are crawling under your skin. Um, Women sometimes will tell me that they notice a strange odor around themselves, and they're not sure whether other people are getting it. And you do all the swabs, and they're all clear, but they mention these things. And of course, you then have all the other symptoms that people do know a little bit about, where you have, lowered mood and lowered libido, and hot flashes and brain fog, and, the longer term the longer term symptoms as well. But those would be some of the more unusual symptoms. But there are a lot of symptoms, some of which we're not even aware of, which may not even be they're not life threatening, they're just nuisance things. And can we put our hand on our heart if there are some other stranger symptoms that it is because of perimenopause, menopause? We don't know, but we do know that estrogen is present in pretty much every cell, and as it depletes, it is not surprising, especially gut health and weight gain. These are all things that are real things. And that's why I have dedicated chapters to gut health, as well as a separate chapter to weight gain in perimenopause and menopause, because these are real issues. Not that I want to make a big thing about weight as such, but it is useful to know the science behind it.
Yeah. And it's nice to have that even as reassurance that that's what it is and not being dismissed,
Correct.
because some people may be not in touch very much with their body, so they may not notice some of these things, but I am like ultra in tune with my body, so
Yeah.
when things start changing, I really want to know, why is this happening? So
Yeah.
some of the things that happened to me were joint pains. I started having more
Yeah.
joint pains and just stiffness and aching. And
Correct.
then you kind of mentioned this a little bit, but sensitivity to smell, but also to sound. So,
Yeah.
especially at some points of the month, like people cannot, like things need to be quiet. Like I can't have anything loud. And yeah, everything smells bad all the time to me. So, like, I was already super sensitive to smell, but now I'm just like extra sensitive to smell. So, yeah, lots of weird things that can happen
Yeah, absolutely.
that
It's
are
just
very
being aware of these
interesting.
things, and sometimes you can make light of it, and sometimes you can take it seriously. But it is important for people to listen, especially if you bring it to the attention of a health professional. I think women are so used to being, the term nowadays people use is gaslit, but women are so used to being dismissed and told to suck up their symptoms that they tend not to want to talk about it. Especially I have a whole chapter, I think, in the book on painful sex, or I certainly, the questions that my patients ask me, I talk a lot about painful sex, because you have to actually probe this out of people, because women often tell me, but I don't want to bother the doctor, they have better things to think about. But no, actually, it's important, and important for your partner to be involved in that discussion, because people may not realize, partners may not realize that actually the hormones are fluctuating or have dropped so much that it's not because she doesn't love you. It's probably because of the fact that her hormones are doing their own thing, and you just need a little bit of time and patience to come out of the other side.
Yes, that's so good. Thank you for bringing that up. What percent of women experience bothersome symptoms?
So we don't actually have too many figures on things like joint aches and all that, because what happens is a lot of women end up going and seeing a rheumatologist, or they just put up with it. They never get diagnosed correctly, and so they may be put on medications that they don't need to be when they actually need hormone replacement. Or you might just put it down to, oh, I'm getting older, and so that is why it's happening. um, or it might be that you make a diet change and things get better. But hot flushes probably has been researched the most, and we do know that 8 out of 10 women in the West will have hot flashes, and but only 3 out of 10 will seek help. Um, on the other hand, if you look at, say, Hong Kong or Singapore, only 17% of women will admit to having hot flashes. Now, is that because they actually have a much better diet? Is it because they don't like talking about it? Is it because the research is not there? We don't know, but we do know that, because we don't have that information. But what we do know is that hot flashes occurs in 80 to 85% of women. It may be very short lasting, it may be debilitating, and 10% will have them lasting longer than even 10, 12 years. So you can have women in their late 60s still having hot flashes, and they've never got help for it. But if somebody has not had hot flashes, or it has died down, and they suddenly start having hot flashes, and they come to you for HRT at 60 or 65 because everybody is now talking about menopause, that is not the right thing. What you must do then is investigate why is somebody having hot flashes when they didn't have any before, because that you do want to rule out new cancers and things like that as well.
Okay, super interesting. Yeah, I remember. So my mom, she entered menopause at 55. And so she told me, and she says she didn't have any perimenopause symptoms, but I don't know. Who knows? She may have not been aware of them. So she's like, oh, don't worry, not going to hit menopause till 55. And then she said that her mom, what happened, because I'm from Panama, it's a very hot country, tropical country. And she said that they get cold flashes there, not necessarily
Yeah,
hot flashes, because it's
yeah,
hot all the time. And so when I was reading through the book and all the things, I realized that actually some people do get cold flashes too, in addition to hot flashes.
yeah,
And that's what they experience in Panama, I guess, because they're already hot enough, I guess. I don't know how that
yeah.
works, but
Well, I'll tell you what happens is that you if you have experienced a hot flash, or if you are somebody who has looked into the science of it, you know that the thermoregulator in the hypothalamus gets reset. So what happens is that you can have this intense feeling of heat, which if you're in a hot country, you might think, boy, it's hot right now, and that's all you think. Then you have this sensation of chill, and that's why the cold flashes or is what your mother was explaining. And it's interesting you say that, because I think a lot of women, and it's good that the human brain has a habit of forgetting unpleasant things. Because my book club girls, who are quite a similar age to me, I'm 62, and so they range from 47 to 96, but the majority of them are in their late 50s, early 60s. And they said, Nitu, why have you chosen this book, Finding Me in Menopause? What is this name? We were never lost in menopause. And I said, well, the book is mine and I was lost. So I'm allowed to call my book what I want. And that I found myself when I found that I had a much earlier menopause. And I suspect the path that my career took would not have taken had I not gone through. So, there's good sometimes of a lot of things that people fear, because I do want people, your listeners, to know, Yami, that for a lot of women, perimenopause and especially menopause can be a second spring. Okay, it can be something to look forward to. There are a lot of good things that happen. It's not all doom and gloom, and I don't want people to fear it. I want people to educate themselves about it, which is why, whether you're very young or in the average age group, I still want people to educate themselves so that you know what to expect, and that there's help out there if you want it. Because if you are not aware of that, when you're ignorant, you tend to be afraid that you're going to look older, you're going to do this, and you're going to do that, and you'll crumble and you'll be a heap of bones on the floor. No, I'm 24 years into, I mean, of course, I'm talking only about myself, but I see lots and lots of women who are able to embrace this phase very beautifully. And I just want people to know that while we're talking about all these symptoms, there's a good chance, first of all, most women will not experience all the 34 symptoms that I discuss in the book. But the reason I've broken my book up into so many chapters, including bone health and protein and, all the questions that women commonly ask me, is for people to realize that you have to understand, first of all, what menopause is, what perimenopause is, and then understand what symptoms to expect so that you can then advocate for yourself. That is the reason to know these things, not to make yourself afraid, because the chances are, if you put in place a lot of things like you have already and like I did, the likelihood is you're going to have a glorious life afterwards. There is life after menopause as well,
Yes,
and a
thank
long
goodness.
life.
Yeah. Thank goodness. Because, yeah, we want the longevity for sure.
Yeah,
Well,
and fun.
before we talk about lifestyle medicine, which of course I know is both of our favorite topics, let's talk about when women seek help or when people that are going through these symptoms seek help. Who should they go to? Our primary care providers, are we at the point where they are well trained to help with these symptoms, or where is the best place to seek help?
I actually think the primary care providers are the best people. They're even better than gynecologists, because usually your family doctor has seen you before, has known about you or your family, and so knows your circumstances, is able to really, join all the dots that we were talking about. So I do think primary care physicians are the first port of call before you try and see gynecologists. I know that at least in the UK, we only refer patients to somebody like myself if the family physician or the GP cannot manage the situation. So I would say that in my experience, primary care physicians are probably better placed. They're more knowledgeable, just like they are more knowledgeable about contraception than many gynecologists. I think they're more knowledgeable about menopause and perimenopause and are interested, and many of them in a practice will develop a special interest in that area. So it is important that you seek out that kind of help. And yes, sometimes you do need, in special situations, you do need to see doctors like myself, where somebody has had breast cancer, or their hormone replacement therapy is not possible to titrate very easily. Certainly there are situations in that, or when you're not sure whether somebody would benefit from it, or if you're under the age of 40 and you've had premature ovarian insufficiency, or medical menopause or surgical menopause, which can be much more harsh than a gradual onset of menopause. So suddenly when you have had a hysterectomy with removal of both ovaries, for example, for severe endometriosis, that discussion has to be had with a specialist. So I would agree with that aspect. But by and large, I think um, primary care physicians are well placed to care for a woman in the community setting, but with the knowledge and support that from good evidence that should be available to them, with the help of classes and courses, and of course experience. The more patients you see, the more people you see, you realize, this would work better. And also directing people to resources. I think, often as doctors, we don't give patients enough resources, which is why I had got so frustrated and set up my own website about 25 years ago. And I have continued to build on it every couple of years, 2, 3 years. I update it with, the latest information, because I want patients to able to go away and read the stuff that I've told them, because it's so hard to try and remember everything when somebody is, talking to you or telling you these things. Your brain sort of goes, psh, when you're sitting in that chair. So I have a chapter actually on all the questions you should ask your GP or your doctor. But I do think that relying on resources that are scientific and evidence based are just as important for both the person who's seeking help, but also for the health professional who's giving out help.
Yes. Okay. Those are fabulous tips. Thank you so much. All right, so let's talk about what women can do to help ease their symptoms, to help ease this transition into perimenopause, menopause using lifestyle medicine.
So, assuming that people will become perimenopausal, say in their early 40s or 47, if that is the case, you don't want to wait till then. So, educating yourself early is really important. And that onus really should be falling also on schools and teachers and the government and the policies, because you do want to educate women about their reproductive system. Because you'd be shocked, 1 in 4 women in a survey in London, they did not know where their vagina was. 1 in 2 did not know where their cervix was. 1 in 10 didn't even know where their entire reproductive system was. So, and this is in a huge metropolis, yeah? So, educating oneself about the different parts, because when you say I'm actually having burning sensation down below, it doesn't actually tell the doctor very much. So you should know the difference between your vulva and your vagina. Otherwise, you will go away being treated for thrush when actually you have a lack of estrogen in the vagina, or you have a skin condition like lichen sclerosis or eczema or psoriasis. So educating oneself about the reproductive system, knowing your body, is really important, because nobody loves your body better than you, is what I have always said, and said it in my first book as well. The next thing one can do is looking at the 6 lifestyle pillars, Yami. I think we just because we seem to know about it, you'll be surprised how many doctors do not talk about the various things that people can do to help themselves. So the 6 lifestyle pillars, and I'll start with sleep, because sleep is something that is so easy to wreck. And it gets worse when you are just before your period. It gets worse in perimenopause and in menopause, and then gets better after a few years after you stopped your periods. But so, what is so important is develop a good sleep hygiene, good sleep routine, making sure that you're not staying up all hours, scrolling, avoiding blue light, eating early in the day, making sure that you're really trying to find yourself in a place where you can calm down and calm your system down, so that you can allow the brain to do its work at night and get rid of all the junk that is collected. And when you sleep well, the next day seems much more tolerable. So sleep is a very important lifestyle pillar that is neglected hugely, and for me that is my biggest problem till to this day. I find it hard I feel my brain is always on go and trying to do things. So sleep is really important. And when sleep gets disturbed, of course, cortisol levels rise, and then weight gain can be a problem for many women as well. So sleep is one of the first lifestyle pillars that I would ask women to educate themselves on, and try and see the importance, because we do know that night shift workers, for example, when they do a recurrent night shift, they have a higher risk of breast cancer risk as well, for example. But that risk then goes away once they stop it. So we know how important sleep is for diabetes, type 2 diabetes, for reducing cancer risk. The second is stress. Now, all of us will have stress. There are different types of stress, and acute stress is good. Me coming up on your podcast and you interviewing me, might be thinking, what am I going to ask her? Or I'm thinking, what is she going to ask me? Will I be able to answer? That's a little bit of acute stress. Or you're talking in front of 150 doctors. Yes, that might be a little bit of stress. That's good for us. But chronic stress causes inflammation, and inflammation is the building block of many, many diseases, including worse menopausal symptoms and worse perimenopausal symptoms. So identifying your stress triggers. You can't get rid of all your stress, okay? You might want to get rid of a partner who's really stressing you out, but for most people, that's not really possible. Often you are struggling between, caring for elderly parents, teenage children who are trying to apply for university or school. So find your stress triggers, identify them, acknowledge them, but then do things to actually mitigate them. So what can you do if you know you're going to walk into the house, into a crazy household? Everybody's asking, Mom, what's for dinner? What's this? What's that? What you can do is spend 5 minutes in your car. Nothing's going to happen if you spend 5 minutes sitting outside and doing some box breathing, doing some breath work. So going for a walk at lunchtime and not saying, oh, you know what, I'm going to work through lunch so I can get off earlier, never happens. So find your own ways of relaxing and reducing that stress. And it might be a cup of chamomile tea, it might be laughing with a friend, it might be going a telephone call. It doesn't matter. All I want women to realize is finding the stress triggers and trying to take measures to reduce them, because stress will have a huge impact on how you experience menopause as well, and insulin resistance and things like that. So that's the second lifestyle pillar. The third one is trying to build a positive social network. So it is so important to surround yourself by people who lift you up, who actually don't pull you down when you're already down. So it is okay to say no to people. It is okay to say, no, I'm not going to drink today. No, I'm not going to come out today. Or I'm not going to go out with that person. Whatever it might be, it is okay to say no and actually find people with common interests and find a way, because we know that loneliness is an epidemic. It's as bad as 15 cigarettes a day. So we want to be surrounding ourselves and finding hobbies and things like that, so that we can actually connect with society, whether it's with charity work, with church work, or temple work, or community work, whatever it might be your thing. Find something so that you can build that positive social connection. So as you get older, you have that to rely on rather than just your family and things like that. That is really important, I think. So we have stress, we have sleep, we have positive social network. The next thing we have is we want to try and reduce uh, substances that do not help us, do not help our health at all. So whatever anybody might tell you about that glass of red wine, there is no health benefit from drinking alcohol. In fact, drinking even 3 units in the menopausal stage can increase our breast cancer risk by 15%. And adding even one more unit to that will increase in a week, will increase that to by another 10%, as well as things like smoking and recreational drugs. You'll be surprised how many people do recreational drugs. So you want to be reducing those substances, and that's the fourth lifestyle pillar. And then you have exercise. And exercise is not just about pounding the gym. It is also about moving your body. So if you are at work, every hour, get up, stretch, do some squats if you want to, go walk around, do anything you want to, stand on your tiptoes and stretch your calves up and down 10 times while the kettle boils. Find ways of keeping your body mobile. Go for a walk in nature, because we know that forest bathing, or shinrin yoku, which the Japanese love, and I've just come back from Japan, is so important, which they don't follow that much because they are actually workaholics. They have such work, very poor work life balance, and that is why all these measures have been brought in. So you do want to make sure that you're moving your body. Physical movement is so important. But one aspect is really important, Yami, and that is strength training. Strength training for children, for young adults, is super important because it builds a muscle mass. Bone marrow density is built on that, so osteoporosis becomes less. But even if you are somebody in your 40s or 50s or 60s or 70s, and I can keep going on, 80s, you should be picking up some weights. Initially, you might want to do them under supervision, but strength training is so important to prevent falls, because 1 in 3 women will actually die from a hip fracture. So you don't want to be that person who is not building your bones with the help of the right diet, as well as with exercise and strength training. So we normally would recommend at least 2 strength sessions of at least 30 minutes per week, as well as trying to move your body for an hour a day. So although the the CDC and the British, the UK guidelines are 30 minutes a day, because we know even 15 minutes a day can reduce mortality, we ask people to try and build an hour a day, whether it's walking to work, taking a lunchtime walk, whether it is playing a sport that you want. It's okay to be a weekend warrior as well, but exercise is so important. It doesn't help you to lose any weight. So anybody is hoping that exercise will help them to lose weight, they will have to then run like Paula Radcliffe or Usain Bolt. No, you are using exercise to improve the hormone balance. You're using exercise to reduce your risk of cancer, to reduce the risk of cancer coming back. You're doing exercise to maintain weight loss. You're doing exercise to maintain tone, but you're not doing exercise to lose weight. So, you cannot walk for an hour and come back and eat a whole bar of chocolate. that will not, your scales will not forgive you. So that's important. And that brings me to the last lifestyle pillar, which I think probably in my book is probably the second most important, because without sleep, sleep is used as a form of deprivation, is used as a form of torture. So sleep is absolutely essential, but nutrition is really important, and what you feed your body is so important, because it does sort of tell you what your experience of menopause and perimenopause can be. Because when you eat anti-inflammatory foods, when you fill your plate with color, so you're eating fruits and vegetables, and particularly beans and lentils are really important, because they contain phytoestrogens or plant estrogens. Plant estrogens are essential, where because they have so many health benefits. Soybean is one of them. It's a magic bean. It is particularly rich in phytoestrogens, and you want to try and eat at least 2 to 4 portions of soy, if possible, every single day. I tend to eat 4 because I strength train. But a cup of soy milk and a handful of tofu or a handful of edamame beans, a bowl of beans, because we know the blue zones or the longevity areas, they all tend to eat beans about 2 or 3 times a day. So we know that beans contain a lot of fiber, a lot of micronutrients, and these plant estrogens that reduce our risk of breast cancer, which are increased when you do have animal products, especially dairy and meat. So you want to be having fruits and vegetables and green leafy vegetables, nuts and seeds, herbs and spices, things like flaxseed and chia seeds, because they also contain plant estrogens or phytoestrogens, green tea, because it helps to reduce your risk of breast cancer, mushrooms. You want to bring all these wonderful plant foods. You don't have to be 100% plant based. It's great if you can, but the more plants you can include into your diet, your gut will thank you. And when your gut thanks you, the bacteria that live in it and decide your health, the estrobolome, which decides how the estrogen is synthesized, will also thank you. And you'll find that, all the things that you tend to do. Also, a plant-based diet, Yami, is calorie light generally. So what happens is, when it's calorie light, weight tends to not stick as much as if you were eating calorie dense food. So whole plant foods tend to be a good win all around, because fiber is so important. Most women are severely deficient in fiber. They get only about 18 grams of fiber instead of the 30 grams minimum that we are required to. And in a whole food plant-based diet, you can get as much as 45 to 70 grams of fiber. So uh, of all the lifestyle pillars, all of them are important, because actually if you don't do one, everything else will fall to bits. But usually when you choose one of the lifestyle pillars, you choose sleep. When you improve your sleep, you'll stress less. When you stress less, you'll reach for that alcoholic drink less. And as a result, you will want to move your body. And when you move your body, you're not going to want it, you sink your teeth into a donut as quickly as you would like to eat an apple. So they're all interconnected.
Oh, that's beautiful, Dr. Bajekal. And I agree that sleep is a keystone habit, because studies show that whenever we're sleep deprived, it automatically makes us crave to eat more.
Correct.
And it makes us crave foods that are higher in sugar, higher in fat, more of those processed foods. It's almost like your body's reacting to a sort of stress, and it's telling you you need to get excess calories because you're going through something really bad. And of course, it just throws your mood off. You just feel crummy when you're sleep deprived. You feel more anxious. You feel more depressed. The world just seems like not a good place when you're sleep
And you
deprived.
tend to
And so
make
you're right.
worse
You don't feel like
choices.
going for a walk. You don't feel like doing those things. And so I agree that if you're struggling with sleep, address that first, because it'll
Yes,
make the other habits so much easier to try to accomplish.
I agree. I agree.
And I also am a bean pusher. I think that not enough people eat enough beans or not used to beans. I know that you're probably familiar with that in the UK too, that, I guess y'all do have beans on toast, but here in the United States, it's even worse. Like, the only type of beans people usually have is refried beans if they have Mexican food, but otherwise, they're not eating beans. And there's a lot of fear of soy. So if you could just address that a little bit, because there's a lot of misconceptions and myths surrounding soy. Is it safe
Yeah.
for people to consume soy? And you're saying 2 to 4 servings a day. It seems like a lot.
So a serving is 80 grams or a handful. So it's not really that much because you're trying to eat between 8 to 10 portions of fruits and vegetables, ideally, which would mean, 4 or 5 fruits and a big salad or a big serving of vegetable soup, for example. So serving is actually not that much. And of course, if you're a child, then it wouldn't be a full apple. It would be for a 5-year-old, it would be one or two slices of apples. So soy is really, I've written a whole chapter in my first book as well in a second book, because it is important to understand that no other food product has been studied as much as soy has been. Thousands and thousands and thousands of studies have been done. Each and every single one of them have shown how safe soy is. First of all, it's a plant. Okay, it's a bean, and it's been used for over 5,000 years in China and in all the countries surrounding China. So we do know that long-term wise, it has got a lot of safety. People are concerned in the US about genetically modified, but there is not a single animal or plant that we eat that has not been genetically modified in some way to prevent pests from getting to them. So first of all, that is not really a concern, but you can get a non-genetically modified soy if you want. But the interesting thing that most people don't know is that most people consume over a kilogram of soy per week because of the amount of soy that is being fed to chicken and fish and animal and cattle. So most of the soy that is being produced is being fed to for animal agriculture, and only 6 to 7% is used for human consumption. So that's important to understand. And actually, you can look for the label. If you are very worried about the genetically modified, you can get the organic non-GM produced. I'm not fussed about it. Of course, in the UK, all the soy that comes in is not genetically modified, but I'm not worried about that. But the thing about soy to understand is that because it is a bean, it has got some unique properties. It has got a high fiber, it has got a lot of micronutrients and vitamins, but it also has protein. All plants have protein, but soybean has got the same amount of protein arranged in the same way with the amino acid distribution as egg white, which is considered, a gym goer's dream to eat an egg white omelette. So but the thing is, the soy doesn't have any of the nasties that an egg has, for example. So in every which way, but it also has plant estrogens. And so rather than giving you man boobs like a lot of people think, it actually will help to reduce your risk of breast cancer, reduce your risks of many other cancers, including endometrial cancer, liver cancer, bowel cancer, prostate cancer. So men who drink milk have a 25% increased risk of aggressive prostate cancer, while men who have soy actually have a 25% reduction in prostate cancer. So that is huge, but it's not publicized enough. So we know that because of the way the soy works, it is an anti-angiogenesis. It means it stops the cancer cells from growing. And so that is another huge benefit. It also helps to lower cholesterol levels. It helps to in weight loss. It helps in bone protection. So we know from a wonderful study, several studies, but there's a wonderful study from Hull where Professor Satyapalan showed that having soy regularly reduces the risk of osteoporosis and helps to build bone. So these are really important things that are not just hormonal health, but also the non-hormonal benefits of soy. So I really would not want people to throw it away thinking that there is something wrong. And if you are somebody who has bloating with beans and soy or anything like that, it's probably because your gut microbiome hasn't got used to it. So what I would suggest is cooking beans really soft and starting with a teaspoon and slowly increasing it over time. In fact, Rohini has given her bloating tips in the gut health chapter. So it is important. I have addressed literally every question that people want in the book, so that there is no fear about the importance of applying diet and lifestyle approaches. Doesn't matter whether you take HRT or not. That's a whole different discussion, because most people who take hormone replacement therapy, many of them are misinformed, so they come off it very quickly and never take it when it would have helped them. But even the ones who do find it helps, most people tend to then stop taking it in 5 to 10 years, and then you have another 20, 30 years that you're going to live. So you want this nutrition and lifestyle to be with you all the way, rather than starting at a later stage. If you are aware of it, start bringing changes. Make small changes. You don't have to eat 10 fruits or vegetables in a day. You can start, if you're somebody who eats just one fruit, maybe add a bunch of grapes, then add a mango, then you add, and don't worry about the sugar. Don't have fruit juices. Fruit comes wrapped with fiber. So if you like cucumbers, start eating cucumbers, and then you bring in some other vegetables like sweet corn or carrots, and you slowly find you're eating 8 to 10 portions. You don't want to jump into the deep end, because you won't go to the gym and suddenly do a deadlift of 100 kilos. So you want to be slowly building up and being kind to yourself, talking to yourself as if you would talk to your best friend or your most loved person. If you would not say those words to them, don't say them to yourself. Absolutely
Oh,
not.
that's beautiful advice, and that's so important. Thank you so much for reassuring us about soy. And the only thing I'm going to add is that it's delicious and it's
Oh,
so
yes.
versatile. And there's so many ways. Soy milk is my favorite because it's naturally creamy. You don't
Yeah.
even have to have any like thickeners or anything added to it. High protein,
Yeah.
so especially for those of us that we are starting to think about that with our strength training, I think it's just a wonderful, versatile food. And
I forgot to say,
I
Yami.
found, yeah,
Yeah, no, you carry on. Sorry. Sorry. I thought you were
I was
finished.
going to say that I found some oil-free roasted edamame that are
Yeah.
just perfect for a snack,
Yeah.
and just a handful, and it makes you feel nice and satisfied, and then you're also getting your portion of soy that way as well.
And I want to say that Dr. Neil Barnard has done a lovely randomized trial as well. It's a small trial, but it's a great trial to show that you can have an 84% reduction in hot flashes when you are eating soy regularly. Just half a cup of mature soybeans in the background of a plant-based diet really made such a difference. So it is important that people start consuming soy and not worry, because allergy is so rare, and most people will grow out of those allergies, but only 3 people out of 1,000 are allergic to soy, truly allergic to soy, uh, while 3 in 100 are allergic to dairy. So we know that that is much more common. So it's really important not to just throw out the soy because of somebody telling us that this is dangerous for you, it'll affect your fertility. In fact, it's probably the other way. It actually protects you in so many different ways. So it is really important for people to include that.
Yay. Okay, we're definitely team soy over here. Okay,
Oh,
great.
yes, I love it.
Okay.
I've got nice recipes
Bef-
in my book.
Oh, yes, delicious. Okay, before we get to the wrap up questions, my last thing that I know that we don't have time to fully address it, but just if you could briefly address what are the indicators that somebody may benefit from hormone replacement therapy, or otherwise known as menopausal hormone therapy. So we have these words like HRT, MHT.
MT.
Who would be a candidate for this? Is it once you are considered menopausal, or is it in that stage in between? When would you consider maybe starting that?
So the most so if you're under 40, unless there's a contraindication, everybody should be on HRT, okay, or MHT. If you're between 40 and 45, there's a very strong case if you've had surgical menopause and you're eligible for it, or medical menopause and you're eligible for it. If you're in the average age group of 45 to 55, we know that the best benefits tend to be around menopause. So perimenopause and just after menopause. So anywhere between 2 to 5 years tends to be what is still recommended, but and ideally under the age of 60. So if you're somebody who's having debilitating hot flushes, you're having low mood, low libido, you're having all those symptoms that are attributable to perimenopause and menopause, and you are willing to have, and you're suitable for it, because some women can't take HRT, but those who can, if you are eligible for it, it's certainly worth a trial, because you can do a trial of 6 months. And if you find that you're much better on it, then you can carry on. Sometimes you need doses to be adjusted, and that's fine, but you will know pretty much within a month whether it is actually helping you or not. And so that is why it is important. And yes, you can have breast tenderness and headache and a bit of bloating and all that initially, and that might put you off, or you might have heard something. But by and large, hormone therapy is safe. It is safe for the vast majority of people, especially when it's taken for a recommended period of time. It can also help with the long-term complications, which are osteoporosis and heart conditions, and maybe even started, earlier, around the ages of later stages of perimenopause and early menopause. It may also help with brain health. I think there are studies starting to come out. So HRT is definitely something that I would never refuse anybody. It's so important. You should not be afraid of it. You may need to take it, but at the same time, you want to bring in those dietary and lifestyle changes so that you can maximize both the hormone therapy as well as the diet and lifestyle pillars, so that you maximize, you live your best life.
Yes. So it's an adjunct to the lifestyle changes, to the
Correct.
dietary changes that you may be making, and it can just help everything along. And I just wanted to clarify, you said that if you're somebody, because when you hit menopause under 40, that's the POI, the
Yeah.
primary ovarian insufficiency. What you're saying is that those people, they should be considering hormone therapy, because having a reduction in those hormones puts them at risk for longer term, right? For the
Yes.
bone health and
Bone
all of
health,
that.
heart health, brain health. So it's not a discussion really. Such a person should be under the care of a specialist, initially at least, to make sure that all the right tests are done, because normally we don't recommend hormone tests and things to diagnose perimenopause and all that. There are no blood tests and things, and I discussed that in detail. But under 40, it is a specialist area. Between 40 and 45, highly recommended that you should be considering HRT. Between 45 and 55 is a discussion that is to be had, but diet and lifestyle is important. And vaginal estrogen, topical vaginal estrogen, is not HRT. And that is very useful for women who even can't take HRT otherwise, but can use it locally, because it helps with vaginal dryness, with painful sex, and also reducing the symptoms of cystitis. As the levels of estrogen drop in the vagina and the bladder, you can find a lot of relief using topical estrogen, which is in the vagina, and it's very safe. And again, I dedicate information in the book to that.
Perfect. Oh, you're a wealth of information and knowledge. Thank you so much. And for our listeners out there, talk to your doctors. Don't keep it to yourself. If you're having these symptoms, you want to know if you're a candidate, even for something like the vaginal estrogen, talk to your doctor. There's no other way to do this except you got to communicate. So
And talk to your
don't
doctor, and
feel
if you don't
don't
get
feel
heard,
shy.
yeah, and if you don't get heard, you need to find a new doctor.
Perfect. I love that. Yes. Okay. So that's been great. Let's move on to some of these wrap up questions. And then at the end, we'll tell everybody where to find your book. What do you wish more people knew? And this can be about anything. What do you wish more people knew?
I I really wish people knew what I didn't know for many years, is the importance of lifestyle on overall health. It has never been given enough attention. And I just think the importance of what we put in our body, how we move our body, how we sleep, how we stress, how we surround ourselves with people, what um, substances we abuse or misuse. I think if people knew that, especially health professionals, I think we would have so much more a healthier society. I really think that.
Yeah, beautiful. How do you define success in this lifetime?
For myself,
Yes.
oh, I think if I can make a difference and make people think about how they're living their life, and if I've helped them to live their life a bit better in their opinion, then I think I've been a success.
Well, then you're already a success because you're doing that all the time, every day. So thank you so much. Okay. So is there a goal or a dream that has evaded you thus far, or something that you have left on your bucket list that you'd be willing to share with us?
Trying to lower my golf handicap.
I love it. So, who do you play golf with usually?
Who do I play with? I play with my
Yes.
husband of 44, my partner of 44 years, husband of 37 years. I play with friends. I play with a lot of girls. I'm quite new to it. When I turned 60, we've got a beautiful golf club, literally the next street, but we've been so busy working all God-given hours. So it was something that I decided we would indulge ourselves in. And I've always been naturally quite sporty, so I do love the sport. I wish I could get better quicker, but yes, that's my goal.
I love it. Well, like anything else, you got to put the time in, right? So you are definitely going to get better. You just got to put the time in. I love
Absolutely.
it, Dr. Nitu. That's beautiful. I'll next time we catch up, I'll ask you how you're doing with that. And what does it mean to be human?
I think being human to me is being aware that we are sharing this world with other sentient beings, that we have been given for some reason a way to reflect and introspect and change our behavior, and that it's never too late to try and live our life so that we can live it without hurting or depleting this beautiful earth and hurting other sentient beings. I think for me that is really caring for other humans who are, trapped in difficult situations, having empathy. I think that to me is being human.
So beautiful. I love that. Well, Dr. Nitu, this has been fabulous. Like I said, you shared so much helpful, useful information that I know that it's going to help a lot of people that will go through this transition or are going through this transition. So I really appreciate you. And thank you so much for writing this book. Fabulous book. I've read it twice already. So I think it's one of those things that it's just very easy to read, but gives you really good information, really good practical information. And there's delicious recipes in there too. So if you could just please tell my listeners where they can connect with you and what products and services you offer and where they can find both of your books.
Okay, so first of all, you don't have to read the book cover to cover. You can pick and choose whichever chapters you want to read. I'm very active on Instagram and especially active on TikTok. So I found my niche on TikTok. So I do like to educate because I know that not everybody can afford to see me. Not everybody will see me. I do want to share the knowledge that I have over 40 years. So social media at Dr. Nitu Bajekal, TikTok and Instagram. And the book is available on all big bookstores in the US, but I think it'll be there in September, if I'm not mistaken. But you can get the Kindle version, and also, of course, online you can get it, and you can get it shipped across as well. So I hope people will enjoy reading Finding Me in Menopause as much as I loved writing it. I'm so happy, actually, the way the book's turned out. And Living PCOS Free, which is all about hormonal health, is now available in all bookstores and online as well, and Kindle.
Dr. Nitu Bajekal, thank you so much. You're so beautiful. I appreciate you so much. Thank you for being such a fabulous guest again. And I hope that you have a very plantastic day.
Thank you. Thank you, Yami. My name is Dr. Nitu Bajekal, and I'm human.
Thank you for listening to another episode of I Am Human. I would be so honored if you subscribe to the podcast so that you never miss an episode. We love our listeners and take your feedback seriously. If you have questions or constructive feedback, you can email us at podcast@dryami.com. That's podcast@doctoryami.com. I am your host, Dr. Yami Cazorla-Lancaster. I Am Human is produced by myself and Alejandra Parra. Graphics designed by Alejandra Parra. Music by Angela Soph with Glowbox Productions and edited by the Castos production team. Remember, human, you are here for a reason. have fun, explore, and live your life to the fullest.